For some people, the impacts of COVID have become a daily part of their lives as they now suffer from long COVID. ABC 10 News has been reporting on this aspect of the pandemic since September 2020, introducing you to the people living with this, the doctors helping fight it, and the experts trying to solve it. Today, as part of our special coverage on the pandemic's 2-year point, ABC 10 News reporter Jared Aarons speaks with long COVID haulers about their journey from sickness to hope.
Mama can carry him now. She can do this now.
For Jenica Harris, just being able to lift her son Rain is a minor miracle.
It feels like everything I dreamt of.
Harris has been fighting the effects of long COVID for 23 months. When we spoke with her in March of 2021, she told us everyday tasks were impossible.
Getting up from the couch to the bathroom was like running a marathon that never ended. I couldn't hold my son. At the time, he was 7 months, and I couldn't hold him for months. And he's quick.
Now she chases Rain around the backyard and says her life is 95% back to normal. But it took time and effort to reach this point.
I'd say about at a year and a half post-COVID is when I really started to see that turn, and it was me again.
Jenica saw countless doctors, went through more than a dozen prescriptions, did physical therapy, and enrolled in 8 scientific studies to find the right combination to get better. She still carries a small bag of inhalers, blood pressure monitors, and an oxygen meter everywhere she goes.
This is the inhaler that I take that is like my best friend.
It's her new normal, but it helps her live the life she wants.
It becomes a part of you, and it's not something that I'm saying this is forever, because I will fight hard until I can't anymore to try to do whatever I can do to get better.
While Jenica's story has a happy ending, that's not the case for millions of other people. The CDC estimates anywhere from 10 to 30% of people who get COVID will develop long COVID issues. Do the math. With nearly 80 million Americans getting infected over the last 2 years, that's anywhere from 8 to 24 million people with long COVID. Some of them won't get better, like Andrew Metza.
I can't walk. I could barely roll around in bed. Can't hardly feed myself.
We spoke with Andrew from his hospital room. He's still using a breathing tube more than 2 years after contracting the virus. It's a far cry from the bicycle-obsessed person he was in 2019.
On my days off and on the evenings and on the weekends, I was riding the Pacific Coast Highway. Loving it.
Now he calls his life a daily battle against long COVID, and against a medical system that he says still hasn't grasped the full extent of the issue. He's been in and out of hospitals, clinics, and more.
Most of them hadn't even heard of long hauler. I've had to educate the doctors and nurses all along the way.
Medical professionals are trying to catch up. UC San Diego Health opened one of the first long COVID clinics in the country. Director Dr. Lucy Horton says treating it is difficult because every patient is unique.
I certainly wish there was a kind of magic bullet for long COVID, but right now there isn't anything, and I'm not aware of anything on the horizon.
Dr. Horton believes long COVID care will become part of routine medicine going forward, another aspect of COVID becoming endemic. And as people like Andrew, Jenica, and millions of others get used to their new lives, they hope the rest of the world understands what they're going through.
For some people it goes away, but not a lot of us. It just doesn't go away.
Just have empathy for people. We're all trying our best.
Jared Aarons,
You too?
ABC 10 News.
Some studies have found COVID vaccines can help prevent long COVID or make the symptoms less severe. That's why Dr. Horton and the long COVID survivors we spoke with all said everyone should get vaccinated. Now, if you have a story that requires an in-depth look, just send us an email. There's the address, tips@10news.com.